You know, lots of people have painful joints. It can make exercise really unpleasant, but that means it's more important than ever to keep moving, to protect those joints and strengthen them too. Here to talk about that, Dr. Matthew Olin. He's an orthopedic surgeon in Greensboro and a member of the Cone Health staff. Good morning.
Good morning. Thank you.
I think when something hurts, our first instinct is, I've got to rest it. I've got to take care of it. And it's against what we think we know when we've got a sore joint, right?
Yeah. So initially, if you do have a sore joint, you are going to want to rest it, maybe use a little ice or some anti-inflammatories. But in general, mild exercise is very good to protect the joints.
Okay, when you say protect them, we're also strengthening. We're making them stronger, so maybe the pain won't be so bad in the future.
So a lot of us decrease our activity as we age, and as we do that, we lose our muscle strength. Our joints become stiff, and so mild exercise that can help keep the joints lubricated is important, but most important is strengthening the muscles around the joints to stabilize them, to keep them healthy.
You mentioned mild exercise. People say walking's the best thing. Is walking truly the best way to get started?
Walking is great. Any exercise is wonderful, but bicycle riding is low impact on the joints, particularly the knees and the hips. Water aerobics is a wonderful way to get some exercise, to burn some calories and keep the joints moving.
Talk about the low impact side of it, because whether you're riding a bike or just on a stationary bike, you're getting a lot of motion, you're getting a lot of aerobic exercise, but you don't have that impact in there, do you?
Yeah, so without the muscle strength around the joints, you put a tremendous strain across each of the joints. So the least impact exercises are great. So bicycle riding is one of those that provides motion, keeps the joints lubricated, but is safe for them. But as you increase your strength as time goes on, then you can increase the activity levels you want to do.
Talk about the difference between when we say working through the pain. If you've got an injury, that's one thing. But if you're just feeling the age that everybody else, that's what we're talking about,
yes.
Right?
As we age, that becomes less of an issue, or more of an issue than compared to when you're a kid playing sports and playing through things. You really want to pay attention to your body. You make certain that you're medically safe to do exercises, that your heart is okay to do things. But it's okay to feel muscle soreness. We love that. You just don't want to have your joints hurt too bad. So if you're doing something that causes you to have a lot of discomfort for 2 or 3 days afterwards, then you've done it too much.
What kind of effect can the cold weather have with that? I know that a lot of times it makes your joints sore. Is that a good time to be out walking if it's just a chilly day?
The cold weather affects motivation. It's hard for everybody to get out when it's cold, to get out.
You're absolutely right about that. Yeah.
But it doesn't. People do feel a little achiness and soreness when the weather chills off a little bit. That's maybe pressure related, et cetera, as the weather folks would know most. But it is important to get out and do things no matter what. If you can keep your joints moving and keep them lubricating, that's going to be the most important fact.
Cold weather is not an excuse.
No.
It may be a factor. Bundle up a little bit out there. You're going to feel better afterward anyway,
yes.
because it's going to, if you are sore because of that, it's going to loosen you up.
Yes, yes.
Okay, great suggestions this morning, and very timely too with the cold weather we're feeling.
Yeah.
Thanks so much. We appreciate that. By the way, if you want to learn more about prevention or new treatment methods at Cone Health, you can do that through conehealth.com/orthopedics, or they've got a lot of healthy lifestyle tools and resources, even information about some classes coming up. Go to conehealth.com/wellness-matters.
House Call on Fox 8 is sponsored by Cone Health.